In case you're wondering whether the Canadian government is still dodging accountability like it's an Olympic sport, buckle up because I have an update on Health Canada's 195-day extension that they took last year on an access to information request and their continued stonewalling on the AstraZeneca vaccine scandal. Let's dig in. Before we get into Health Canada's stonewalling and skirting of transparency, let's rewind. Back in May of 2024, while AstraZeneca was quietly pulling its experimental COVID-19 vaccine from the global markets, because, nothing screams safe and effective like a product being yanked off the shelves, I was busy filing an access to information request with Health Canada. I was digging for the truth behind their so-called oversight of this experimental pharmaceutical rushed to market through an interim order, which is Canada's version of emergency use authorization. This was a product they authorized, mandated, and later suspended. Specifically, I was requesting all documents detailing the testing and quality control measures that Health Canada claims they conducted to ensure the safety of 1.5 million doses of AstraZeneca imported from the contaminated Baltimore, Maryland plant. You might remember that plant because it was the one with shoddy disinfection practices, poorly trained workers, and mishandled raw materials. Yeah, that's the gem that we imported millions of doses that were shipped into Canada and Mexico before manufacturing was halted. But don't worry, folks, because Health Canada issued a statement on April 25th, 2021, patting themselves on the back, saying they verified those 1.5 million doses and that they met quality specifications. They claimed they reviewed test results for every vaccine lot and scrutinized AstraZeneca's quality control steps to mitigate contamination risks. This sounds airtight, but I'm calling their bluff. I asked for the receipts, every test result, every document, every quality control step they supposedly reviewed. It sounds simple enough, especially if it was actually done. So if Health Canada did their job, this should have been an easy handoff. But as the 30-day deadline for our access to information request approached, an analyst named Nathan Leduc reached out saying that they had about 100 pages of records, which doesn't sound so bad, but plot twist, if we wanted the hyperlinked information Health Canada actually used to verify the vaccine's safety, that would balloon to over 2,000 pages. Oh, and it would require, of course, an extensive consultation with AstraZeneca, that's the third party, and trigger a massive delay. Once again, this confirms that Health Canada doesn't have their own data. They need to phone up Big Pharma to double check because they blindly trust their science. That's not oversight. That's just simply outsourcing. So I went back and asked them to include all the hyperlinked info that they relied on. No shortcuts. And what did Health Canada do? Well, they slapped me with a 195-day extension, citing that need to consult AstraZeneca to see if they're cool with the public seeing the truth. Because apparently Canadian taxpayers, the ones who funded this whole mess, including the salaries of these bureaucrats, well, they apparently don't deserve to know how Health Canada ensured the safety of an experimental vaccine that they were coerced into taking. Fast forward to now, it's over a year later, and where are we? Well, the analyst working on our file is conveniently away, and his colleague says they're still waiting on the department to clarify some things while processing the records. Clarify what exactly? How to keep dodging accountability and keep Canadians in the dark? This file is already months overdue, and they're still playing bureaucratic hot potato. Once the analyst is back, we'll be pressing for a real update and a timeline on this farce. But let's be honest, every day they delay is another day that they're betting we'll forget. This isn't just about paperwork. This is about a government that mandated an experimental product, claimed they verified its safety, and now they can't or won't show us the proof. If Health Canada had the test results and quality control steps they brag about, these documents would be on my desk by now. Instead, it's extensions and excuses. Canadian taxpayers deserve better. We paid for the vaccines, the bureaucrats, and the fallout. We deserve to know what Health Canada did or didn't do to protect Canadians from this contaminated product. Health Canada claims to be all about openness and transparency, but their endless delays and excuses prove that they're more committed to covering their tracks. For Rebel News, I'm Tamara Ugolini. Stay tuned for this update and many more government accountability reports just like this one at rebelinvestigates.com. At that website, you can support our fight for the truth and transparency. That's rebelinvestigates.com.